I've provided a safe and private environment, and I've introduced myself to the parents and obtained consent for them to perform this newborn assessment. I've also obtained a birth history, which includes a vaginal or C-section, if forceps were used, if it was a long or difficult labor, or if baby was big. I've also obtained a set of vital signs, which the normal temperature range would be 97.7 to 99.5. The normal respirations are 30 to 60, and then the pulse rate, I would expect that to be 120 to 160. I would obtain a length, a weight, a head circumference around the eyebrow line, a chest circumference around the nipple line. And then upon my general assessment, everything appears to be well aligned, symmetrical, muscle tone appears to be appropriate, baby's cry is adequate. There is good range of motion in the extremities. I see 10 fingers, 10 toes. I don't notice any clubbing in the feet. I would check the orthogonal, which checks for hip dysplasia. So I would want to flex the knee and abduct it, and if it were positive, I would feel or hear a click. While assessing the skin, I could note a few things. Vernix, which is a white cottage cheese-like substance that protects the skin. Milia, which is small white dots that would be on the face. Lanugo, which is fine baby hair. Erythema toxicum, which is also known as baby acne, and so that is like red spots, almost kind of looks like a rash. That's bright red. You could note Mongolian spots, which are birthmarks that appear dark and bruise-like, or petechiae, which are small red pinpricks on the skin. While assessing head, I'm feeling the anterior fontanelle, which is larger than the posterior fontanelle, and it's diamond shaped. I don't feel bulging or sinking on either the anterior or posterior fontanelle. I could note a cephalhematoma, which is blood clot in the lower layer. I could also note caput, which is generalized edema. Baby's face appears to be symmetrical. The eyes are symmetrical to the face. The iris is gray, which should change over time. No signs of infection in the conjunctiva. The pupils are round, reactive, equal to light, with no accommodation, which is expected. There is strabismus noted, which is also known as a lazy eye, and that should correct itself. The nose is patent. Feeling the ears. Baby's ears feel well formed. I don't feel any deformities, and they are symmetrical. If the ears did feel as if there was a deformity, that could indicate kidney damage. Now assessing the mouth, I would use a gloved hand with my pinky. I would feel across the hard and soft palate to feel for any openings, but we would want that to be intact. I could note Epstein pearls, which are small white calcium deposits that are normal and go away. The clavicle feels well deformed. Don't feel any abnormalities there. The neck looks good. So no deformities for neck or clavicle. Assessing the chest, it looks symmetrical. The shape is okay. Doesn't look like distended or concave. The breast buds are 3 to 5 millimeters, which is normal. I don't see any nipple engorgement. I would listen to breast sounds, and I could expect to hear crackles within the first 24 hours, which is normal, but they should go away after that. I will assess the apical pulse with my stethoscope for 1 full minute, and while listening to heart sounds, I could also note a murmur, which should go away. While assessing the abdomen, I would want to note that it does not feel concave or distended. I would want to note that the umbilical cord, if it were less than 12 hours after delivery, I would note 2 arteries in 1 vein. If it had been 12 hours since delivery, then I would want to be assessing for any signs of infection, and I would want to make sure that that umbilical cord stayed dry and intact. And then while assessing bowel sounds, I would expect to hear bowel sounds after baby has the first feeding, And also after that first feeding, I could expect a meconium, which is the first bowel movement, and it's black and tar-like. Assessing the genitals for a female, you want to make sure that the labia cover the clitoris, and you'd want to know any discharge. For a male, you would want to make sure that that meatus is centrally located at the tip of the penis. You would want to know if the testes distended, and you would also want to know any rugae on that scrotum. And for both male and female, you want to note voiding patterns and make sure that those are within a normal expected range. Next, I'm going to move on and assess the spine. So for the spine, I don't feel any openings. It appears to be midline. The anus, I'm not testing patency for that, and it did give a wink appearance. It flexed, so that means that the anus is patent. Next, I'm going to be assessing for the reflexes. So the first reflex I'm going to assess for is the Mora reflex, which is also known as the drop reflex. So you drop baby back about 30 degrees and it should startle. The tonic neck reflex is if baby's head is turned to the left arm should extend, the right arm should flex. You have the Rudy reflex. So if you rub the left side, baby should turn head to the left. You have the Palmer reflex. So if you put your finger under baby's fingers, baby should wrap her fingers over yours. If you put your fingers under baby's toes, that would indicate that the plantar reflex is intact. We can do the stepping reflex. So if you hold baby up like this, it should appear as if baby is trying to walk. You have Babinski's. So you would want to rub your finger up and the toe should flare out. You have trunk incurvation. So you stroke the side of the spine and baby should flex in that direction. And then I would be assessing the suck and swallow reflexes while baby is feeding. And throughout the assessment, I have noted baby's behavioral state, which baby would be in a quiet sleep state, sorry. And so with that, I've assessed rapid eye movement, change in facial expressions, and the extremities. There was some movement in those. So before leaving, I had made sure baby is safe and that the parents did not need anything, and that concludes my newborn assessment.